Welcome, everyone. It's been wonderful looking at the chat and seeing where you are all from. So I appreciate that you're spending this afternoon with me. And I will go ahead and get started with a disclaimer. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, SAMHSA, or the U.S. Department of Health and Human Services. And I'm sure they're very happy that we have read that disclaimer. Okay, so what is the Pacific Southwest Mental Health Technology Transfer Center? It's part of SAMHSA's new Mental Health Technology Transfer Center. So it's specific to the Pacific Southwest, and it is to serve the mental health workforce in Region 9, which includes Arizona, California, Hawaii, Nevada, and the Pacific Islands of American Samoa, Guam, Marshall Islands, Federated States of Micronesia, Northern Mariana Islands, and Palau. It is really directed at that region, but as you will see from the presentation today, much of the information is applicable throughout the nation. And so I see that we do have some folks joining us from outside of Region 9, and you are welcome as well. Here at the Pacific Southwest Mental Health Technology Transfer Center, our model is collaborative, and we provide training and technical assistance and resource dissemination that supports the mental health workforce to adopt and effectively implement evidence-based practices across the mental health continuum of care. Our goal is to promote evidence-based, culturally appropriate mental health prevention, treatment, and recovery strategies so that providers and practitioners can start, strengthen, and sustain them effectively. We have a number of resources that are available to you. You can access them without any cost to you or your organization. We have webinars, a newsletter, affinity group learning, online courses, tools, regional trainings, individual coaching, and individual consultation. But before I move on, I actually want to say a word about the services. So today's session has been recorded and will be available to access on our webpage within a few weeks. This is so that we can be in 508 compliance, which will essentially make the recording accessible to people with disabilities. If you would like to learn more about the topics we covered in this session, please reach out to the Pacific Southwest Mental Health Technology Transfer Center for additional resources. You will see the session handouts that are available to you, both the presentation for today as well as the accompanying fact sheet that I put together that this webinar is based on. If you have input on how we can best support your learning and the field with more information related to this topic or on other priority topics, please complete our needs query on our webpage. The query is used to design the opportunities that we offer each year. So if you have good ideas, please do not keep them to yourself. Finally, and very important, our ability to continue offering no-cost training and technical assistance depends on completed feedback forms from our participants in each session. That would be you. So the form we are required to use by our funder is quick and easy to complete. It will appear on your screen after you exit the session, but there's a little catch. They did make it a little tricky because the form we must use has the term addiction where it should read mental health. So when you see the term addiction, respond based on the focus on mental health. The funder is not able to update the form with the correct terms until later this year. It's still critically important for us to have your feedback, and completing the form means we can continue to improve our offerings and provide them to you and your colleagues at no cost. It only takes a few minutes, and by completing this form, you are ensuring that we are able to continue providing services. So thank you, and we look forward to your feedback and seeing you again at another one of our learning sessions. And now we shall move on. So a little bit about me. I'm a developmental psychologist. I've worked primarily in the world of nonprofits and government since the mid-90s, also some in for-profit and philanthropy, but primarily in nonprofits and government. My passion is in the pursuit of social justice through institutional systems change. And that change can really only come about when other people are united and mobilized. So I also specialize in stakeholder engagement, in coalition building and strategic partnerships. And I bring an equity lens to all of my work, whether that's teaching, training, strategic planning, or evaluating. And I'm really glad that you've joined me today. Thank you. Our objectives for the time that we have today: to recognize the connection between the social determinants of health and improved mental health outcomes, to access tools and resources to support appropriate assessment, explore strategic thinking for community mental health partnerships, learn what kinds of questions and data will lead to these partnerships and how to evaluate the opportunities that exist within them, and establish a framework for incorporating the social determinants of health into your everyday lens. So we better get started. That is a lot on. Our agenda is primarily broken down into this why, what, and how. So why should the behavioral health field be concerned about the social determinants of health? What is being done to address the social determinants of health? How can we get started on addressing our social determinants of health? And an opportunity for you to ask your questions and have a bit of a closing. You may hear me use the terms behavioral health and mental health somewhat interchangeably, although they're not exactly the same. Behavioral health includes not only ways of promoting well-being by preventing or intervening in mental illness, such as depression or anxiety, but also has an aim preventing or intervening in substance abuse or other addictions. So as such, mental health is included in behavioral health. It's more of an umbrella term. So why should the behavioral health field be concerned about the social determinants of health? This is a graphic from King County, Washington, that helps us visualize the roots of a physically and mentally healthy society for all. Notice how many of these roots have little to do with traditional physical or mental health care. You can see some of the ones that are on there, like family, wage jobs and job training, early childhood development, economic development, strong and vibrant neighborhoods. So why do we as behavioral health providers need to be concerned about the social determinants of health? Mental health and many common mental disorders are shaped to a great extent by the social, economic, and physical environments in which people live. We as behavioral health providers are striving to provide the highest level of care to the individuals and communities that rely on us, so it's important that we are as current as possible with our knowledge of the field. The current trend in our training focuses on the genetic and behavioral components of mental illness. This focus prioritizes medication management and support for individual behavioral change. But what if we considered that medical care, healthy behaviors, and genes and biology altogether account for only about half of the society's overall health outcomes? Then we could begin looking seriously at the environmental and social conditions that play an outsized role in the mental health and well-being of those in our care. We call these conditions the social determinants of health, and they're listed in this slide, which was originally published by the California Department of Public Health Office of Health Equity. So these are the social determinants of health that essentially the state of California decided that the Office of Health Equity needed to track and respond to. And so listed here are prevention, mental health services, culturally and linguistically appropriate and competent services, income security, housing, neighborhood safety and collective efficacy, environmental quality, healthcare, child development, education and literacy rates, food security and nutrition, built environments, and discrimination and minority stressors. So this is not necessarily all of the social determinants of health, but those that were called out by California's legislature. Research has shown that the social determinants of mental health are largely the same as the social determinants of chronic physical health conditions. So we're really speaking about the same things, and we're going to go through that, how they really come together, whether it's about manifesting in chronic physical health conditions or mental health conditions. The U.S. Centers for Disease Control and Prevention, the CDC, defines the concept of the social determinants of health as the complex, integrated, and overlapping social structures and economic systems that are responsible for most health inequities. Drawing on a report by the World Health Organization and the Commission on the Social Determinants of Health, the CDC elaborates. These social structures and economic systems include the social environment, physical environment, health services, and structural and societal factors. Social determinants of health are shaped by the distribution of money, power, and resources throughout local communities, nations, and the world. The World Health Organization defines the social determinants of health as the conditions in which people are born, grow, live, work, and age. The primary categories of conditions include access to and quality of education for children and employment for adults, the distribution of wealth and other forms of opportunity within society, and characteristics of housing and other built structures. To illustrate the implications for mental health on a single social determinant of health that is highly relevant for the Pacific Southwest, let's turn our attention to food insecurity. A growing body of research highlights the negative consequences of food insecurity for children's developmental, behavioral, and mental health outcomes. These consequences can include psychological stress, depressive mood, anxiety, behavior, and substance disorders, children's ability to make and maintain friendships, and reports of thoughts of death, desire to die, and suicide attempts among teens. Cities in this region account for 11 out of 43 of the most expensive cities in the world, providing an indication of the Pacific Southwest outsized cost of living. While food insecurity is an unfortunate condition across communities throughout this region, many rural and isolated areas in particular struggle with the basics, such as access to affordable, healthy food. Swaths of northern and central California, southern Nevada, and much of Arizona are in this unenviable position. In the Pacific Islands, the Federated States of Micronesia and the Republic of Marshall Islands were included in a UNICEF report that raised an alarming picture of rising food prices, with the cost of some staple food items up by as much as 50 to 100% since 2009. Families reported increased economic stress meeting the increased cost of food, with impacts on children's access to adequate nutrition, education, and protection. For small island economies, the degree of food self-sufficiency has been identified as an important indicator of food security. The pain of hunger and food insecurity impacts virtually all racial and ethnic groups and geographic regions. However, the data from California show that low-income Latinos, African Americans, and American Indians and Alaska Natives have been disproportionately impacted by hunger and food insecurity. More than 40% of these individuals experience food insecurity, as do more than 26% of all California children. Ironically, many of California's most food insecure communities are located in the very heart of the state's agriculturally rich and increasingly Latino San Joaquin Valley. For example, the percentage of children in Fresno County who are food insecure is almost double that of food insecure children in San Mateo County. And I'm calling in today from the Central Valley, which is connected to the San Joaquin Valley in California. What the social determinants of health model also illuminate in this graphic is that stress from a single factor, like food insecurity, doesn't happen in isolation from other factors. Most often, the negative social determinants cluster, causing a cumulative effect. As such, stress is experienced in the context of broader social, economic, and political settings that, when combined, can be highly taxing for people who are already facing the greatest inequities and vulnerabilities. When experienced in these contexts, stress can have a more deleterious effect. For example, those living in poverty tend to have increased levels of stress coupled with social exclusion, lack of social capital, malnutrition, and exposure to violence and trauma. With this cumulative effect, stress becomes a major risk factor for mental health disorders. So sometimes we think about it like you have a big sack on your back, like a big backpack on your back, and you get one big stone that's placed in that backpack that weighs you down. And then you get another one, and then you get another one, and another one. And so if you can kind of have that as your mental imagery, it's this cumulative effect of the social determinants of health that are going to really impact individuals and families as opposed to if you were only to have one or two, which it generally doesn't work like that. It generally works that they cluster together.
And Tamu,
so we can ask what is being done. Yeah.
I'm sorry, before you move on to the next section, it looks like we have a question.
Oh, are food insecurities due to food desert areas? They can be, but it's not the only reason that they are. There are people who live in areas that have food aplenty and still have lots of food insecurity because they don't have the funds to be able to purchase the food that they need. Right? And so food deserts can contribute to food insecurity because it makes it just that much harder to be able to get your hands on food, especially nutritious food, healthy food, food that is affordable, right? And so food deserts can for sure exacerbate the problem, but it isn't the only problem. Thank you for asking that question, Alejandro. So in speaking about food insecurity, you take a place like Orange County, which is in Southern California, where Disneyland is, where there is lots of industry, lots of business. It is actually a very wealthy county in California. And yet, there are many people who are food insecure. So answering your question, Alejandro, it's not a food desert in Orange County. There are lots of places to be able to access food. It's a very urban county. And yet, the public health officer of Orange County was very alarmed at the rate of food insecurity, Dr. Eric Handler, and became involved in this movement essentially to recover the food that was being wasted in the county. And he was able to see that actually a lot of the food that was being wasted was due to the fact that people who had excess food from restaurants and whatnot were not knowledgeable about the public health laws that said that they were actually able to donate that food and not be liable. And so he worked with this coalition, Waste Not OC Coalition, in order to do a lot of education around what those public health laws were and to really match up food recovery with food insecurity, which is a really fantastic local model that a lot of people have been putting their attention on statewide and nationally. And so it's one that I wanted to highlight to you. So you can see that there's a lot of outreach that's been involved in this model in terms of environmental health inspectors who are part of the solution, food service sales representatives, trade and service organizations, and the Waste Not OC outreach teams. There are lots of logistics that are also a part of this solution, which include best practices for food handlers. They build upon current resources and partners, so it's not like they're looking to somehow go out and purchase food from outside of the county. They're looking at what are the resources that they already have that are there, and then also using food recovery software and innovation, that they have a food recovery kitchen where they're able to repurpose and repackage, and they're doing a culinary training program for the VA, probation department, and EDD. EDD is the Employment Development Department in California. So matching that against the food insecurity that exists, a lot of that is just identifying food insecurity. So they came up with screening questions, and more than 60,000 clients have been surveyed at Children's Hospital of Orange County and 15 family resource centers. So they really wanted to make sure that the folks that were coming in contact with families were just asking them these basic questions around food insecurity. And then getting pantry support, so doing a needs assessment and providing resources to the local pantries, doing food safety training specific to food recovery, and directing folks to the nearest pantry so that they could actually access the food that was available for them. So Waste Not Orange County has a Google map with over 200 pantries. They incorporated it into their 211 Orange County website. So 211 is how to get local information. And you can just enter your zip code to find your nearest pantry. It is such a simple, kind of elegant solution to this incredible problem of food insecurity that, as we've talked about, has so many implications for physical health and for mental health. And so I also wanted to just pull for you off of their website their listing of their partners so that you can take a look at the kinds of organizations and businesses that are involved in making this happen. And in speaking with Dr. Eric Handler about this coalition, one of the things that I was really delighted by was this partnership with Yellow Cab Company. So Yellow Cab Company has become a partner in order to literally transport the food. So if there's excess food that's going to be wasted, for example, at a restaurant, then Yellow Cab Company will send a taxi driver to go and pick up that food and bring it to a pantry. So sometimes it's just a matter of kind of stepping back and thinking differently about the problems that we're presented with and who in our community may be able to help solve those problems. They may not be the usual players that we are accustomed to working with. And I would encourage you to take a look at their website if you want to know more. Their website is wastenotoc.org, which is on the previous. So you have it here, wastenotoc.org. While conducting the research to develop this webinar and its accompanying fact sheet, I was fortunate to speak with a number of individuals who work in programs and organizations addressing the social determinants of health. They were really generous with their time in speaking with me, including Marie Vorsino at Parents and Children Together in Hawaii. Parents and Children Together strives to make a difference in the lives of Hawaii's most vulnerable. Helping children and families in communities of concentrated poverty is at the heart of what they do. As such, they have a vision that individuals and families have the skills to realize their economic dreams and full potential. And they have an economic development center which offers programs to strengthen an individual's ability to secure and keep employment. So that offers economic one-on-one coaching, employment development, which focuses on pre- and post-employment training and support services, and job placement so that employment placement specialists can assist participants in finding rewarding, gainful, and sustainable employment. Because in addition to other problems, we have research around income inequality and how it really manifests in real ways in our lives and real problems. And so it is also associated with substance use disorders and substance-related outcomes. For example, a New York City-based study showed that the risk of death from a drug overdose was significantly higher in neighborhoods with greater income inequality. To truly address the increase in risk for mental illnesses and substance use disorders associated with high levels of income inequality, providers must advocate for programs and policies that reduce poverty and support greater economic equality in our society. And then a project that I had the opportunity to work closely with because it is administered through the Office of Health Equity in the California Department of Public Health, where I served for about 4.5 years up until last year, is the California Reducing Disparities Project. They are a statewide model that addresses the social and environmental determinants of health. So within the strategic plan that they put together for the project, they have outlined that in order to effectively reduce disparities, we must address the social and environmental factors that impact the daily lives of Californians. Socioeconomic status is a fundamental factor in Californians' health. Education, employment, and income all combine to directly influence access to both social and economic resources. A better education leads to a better job, and a better job leads to a higher income. Higher incomes relieve the stress of having to decide between seeking services and putting food on the table for your family. These are some of the key factors that impact health and mental health, and they are a primary cause of California's health inequities. So one of the goals from the Office of Health Equity statewide plan that I helped to author includes build broad-based community support of health and mental health equity issues through education and dialogue, heightening awareness of the social determinants of health. And within the Community Development and Engagement Unit within the Office of Health Equity, they are doing this by overseeing $60 million in resource allocation through the California Reducing Disparities Project over a 4-year period. So that's $60 million that is going throughout the state of California to communities that are looking to really reach underserved and inappropriately served communities of color and LGBTQ communities with mental health services that are being evaluated very stringently over the period of this project so that we can really lift them up as being evidence-based projects in the future. The Community Development and Engagement Unit also has a goal to meaningfully engage diverse community stakeholders by meeting with local stakeholders around the state to hear concerns and feedback that will continue dialogue and build upon community engagement momentum, and also to collect data pertaining to mental health equity outcomes, inequities, and community participatory evaluation processes. And I see that Laura Leonelli has joined us on the line. She was a colleague of mine at the Office of Health Equity. Laura, are you able to unmute your line so that you can give us a brief update on where we're at with the California Reducing Disparities Project? Okay, Laura, I'm going to move on, and if you're able to figure out how to do it, then just cut me off. So how can we get started on addressing our social determinants of health? To truly address the increase in risk for mental illnesses and substance use disorders associated with high levels of income inequality, providers must advocate for programs and policies that reduce poverty and support greater economic equality in our society. This extension of our role in the behavioral health field will require some new skill sets. We likely already feel very comfortable with case management, behavioral therapies, and health education, but to be effective at altering the social determinants of mental health, now we must also develop our ability to address the dynamics of social justice, political will and power, policy action, and resource distribution. This requires working in the areas of community capacity building and organizing, civic engagement, strategic partnerships, and advocacy. So this is a graphic from a model that's been borrowed from the Bay Area Regional Health Inequities Initiative and also was put into the statewide plan by California's Office of Health Equity. And I just appreciate it because we're able to see in this visual essentially where emerging public health practice is. And it's really in this area off to the left of addressing the social inequities that we see in class, race, ethnicity, immigration status, gender, and sexual orientation, and how those inequities play out in our institutions, corporations and businesses, government agencies, schools, laws and regulations, and even our not-for-profit organizations. So we really do have to address our living conditions, which is the physical environment, the social environment, the economic and work environment, and the service environment, if we are ever going to get to the point where we're not constantly trying to put a Band-Aid on essentially this gushing wound, right, which is what we're doing as we're working further downstream, where we're really focusing our energy and attention on individual health education, case management, and healthcare, which are all very important and which we want for ourselves and the people that we love. We want for those services to be readily available, to be culturally and linguistically competent. But we all know that if we only focus our attention there, we're never really going to get at the heart of the problem. So that's why I really appreciate this particular graphic. Addressing serious mental illness and engaging in evidence-based practices for mental health promotion and treatment require multifactorial intersections. No individual organization or even sector can do it alone. Strive for partnerships with civil rights advocates, early childhood educators, education and employment experts, urban planners, healthcare institutions, health plans, and other professions in the public health arena and in the realm of policy and politics. It is these social justice collaborations that are required to dismantle generations of historical, political, and economic inequities that are embedded throughout the social determinants of health.
Hello, this is Laura. How can I be of help?
I was just wondering if you wanted to give a little update on where the Office of Health Equity is with the CRDP, with the California Reducing Disparities Project. How many organizations are being funded, and what are they being funded to do?
Right. We have 41 contracts out. We have one statewide evaluator, 5 technical assistance providers, 1 for each target population, and then 35 pilot projects, 7 for each target population. So it's a network of organizations up and down the state. The key components are the pilot projects who are implementing culturally specific mental health interventions for their particular population. And these are community
And do you want to
defined.
name what those are?
All of them?
Oh, I'm sorry. No. The 5 priority populations.
Oh, yes. Sorry. African American, Latino, Native American, Asian Pacific Islander, and LGBTQ.
Fantastic. And so what are the ways that you've been seeing that the grantees, the partners, have been engaging around the social determinants of health?
Well, there's a wide variety of strategies that are being used, and they were all compiled in population reports specific to each priority population. But one example that I can use that was from your earlier slide was health navigation that are being done by several grantees across a couple of different hubs. In other words, people are increasing access to mental health services by either combining mental health with primary care and having health navigators to assist people with, for example, language inabilities or language differences. There may be people who are undocumented. There are people who have other barriers to access mental health. And, there's even a project that has youth who are being trained to be promotoras, and we have one project that is training culturally specific peer counselors, so there's a wide variety of strategies.
Thank you, Laura. I appreciate that. So if folks are interested in learning more about this project, they can just Google the project, the California
Reducing Disparities Project. That's right.
That's probably the easiest way for it to come up because it's a government link that has a long link. Is that correct?
Yeah, that's true.
Okay. All right.
That's
well,
right.
fantastic. I appreciate you joining us. So I don't know if other people have questions, but if you put them in the text box, then it's possible that Laura can respond to you as well. And so what you're looking at here comes from the National Quality Forum. This framework positions the healthcare system as playing a central role in connecting individuals to social services, just as Laura was just talking about. It illustrates the importance of collaboration and partnerships between health and health-allied sectors and the utility of social needs data in healthcare delivery. And it also builds on the work of the National Quality Forum's roadmap to achieving health equity, which emphasizes the role of care that addresses the social determinants of health, supporting social services needs within clinical visits and community and health systems linkages. Social needs data can be used to deliver what we call informed healthcare and also targeted healthcare. Informed healthcare involves using information on social needs in clinical decision-making. So, for example, providers can dose medications around work schedules or the availability of refrigeration, connect patients with mobile health services that can improve access, and increase the flexibility of their hours of operation. In essence, providers can tweak the delivery of medical care to better meet social needs. Further, providers can provide targeted health care by implementing interventions to address social needs like connecting individuals to organizations that can assess their eligibility for social service programs, such as what we were talking about with Waste Not OC, that as you're providing your healthcare services, you're asking about food insecurity and then making those linkages. And providing you with the questions that were used in a workshop that took place in December of 2016, the National Academies of Sciences, Engineering, and Medicine held a roundtable on population health improvement called Exploring the Infrastructure of Multi-Sector Community Health Partnerships, a workshop. And I think that these questions are excellent for thinking through our multi-sector community health partnerships. You'll have access to this PowerPoint. You do have it. So you will have the questions and you can discuss them with your team or your staff or volunteers or existing or potential partners. You can also think if there's any of these questions that you want to share or any of the answers to these questions that you want to share while we're on our presentation today. If you want to put any of your answers into the chat box, you're welcome to. I'm just going to go through so that you can see them. So what are the resources and capacities needed to initiate and sustain community health partnerships. If you want to answer any of these, you're welcome to share what you've been able to see, the resources and capacities that are needed to initiate and sustain community health partnerships. What are the principles and practices of engagement and power sharing in multi-sector community partnerships, such as language, roles, leadership development, individual residents, and institutional relationships? I think that power sharing is incredibly important because it's not something that we generally talk about, but it can make or break a partnership. How do you build the relationships and bridges that enable you to work with people that have different viewpoints and personal and institutional positions of power, particularly at moments of community pain and polarization? So this is a question that's also worth going pretty deep on with the people that you work with and that you're looking to partner with. What are the other barriers and challenges to building and sustaining community partnerships? And then a few more. Your proudest accomplishment, what's been most meaningful to you in doing this work? If you're looking to partner with folks, they should know, what is it that you're proud of? What is it that you're accomplishing? Essentially, what is it that you're bringing to the table? And then this one, which people don't want to talk about. Have you made mistakes? If you could go back to the beginning and start from scratch, is there anything that you would do differently? I think it's also important when we're getting into partnership with folks to talk about the mistakes that we've made. Sometimes we've needed to shift positions on something because we started out in one place, and as we got better educated or knowledgeable, we realized that we needed to shift a position. How do partnerships use data to inform learning, strategy, decision-making, and future actions? How are partnerships evaluated and their impact measured? And how can community health partnerships use communications and social media to advance health improvement agendas? Everyone is not comfortable with that communications and social media aspect, and so it's important to really talk it through because it's almost impossible to do this work in this day and age without getting a handle on it. With your partners in place, you will need to go through a process to determine which strategies will have the most impact based on which social determinants of health are most prevalent for your clients and program participants. Fortunately, free resources exist to help you identify best practices for specific social determinants, complete with databases and tools to support your selection and implementation efforts. The County Health Rankings and Roadmap site highlights the annual rankings, which provide a revealing snapshot of how health is influenced by where we live, learn, work, and play, enabling a starting point for change in communities. Maximize your chances of success by choosing policies and programs that have been shown to work in real life and that are a good fit for your community base on your local data. The What Works for Health database provides evidence summaries and ratings for policies, programs, and systems changes that can improve health. The Roadmaps to Health Action Center lays out a series of steps for creating healthy communities, and this is all available to you within this link, countyhealthrankings.org. Right now it's just a snapshot that I took when I did a search on Arizona. Here's another tool, PREPARE, which stands for Protocol for Responding to and Assessing Patients' Assets, Risks, and Experiences. Consists of a set of national core measures as well as a set of optional measures for community priorities. It's informed by research, the experience of existing social risk assessment, and stakeholder engagement, and it aligns with national initiatives prioritizing social determinants such as Healthy People 2020. Measures proposed under the next stage of meaningful use, clinical coding under ICD-10 so you can actually get reimbursed, and health centers' uniform data system. It also emphasizes measures that are actionable. Within the core measures, there's race, education, ethnicity, employment, migrant and or seasonal farm work, insurance, veteran status, income, language, material security, housing status, transportation, housing stability, social integration and support, address or neighborhood, and stress. And then the optional measures include incarceration history, safety, refugee status, and domestic violence. And this implementation and action toolkit is freely available online and contains resources, best practices, and lessons learned to help guide each step of the implementation process, ranging from implementation strategies and workflow diagrams to electronic health record templates and sample reports. to examples of interventions to address the social determinants of health. The Prepare, Implementation, and Action Toolkit is modularized, with its chapters focusing on the major chronological steps that are needed to implement a new data collection initiative on socioeconomic needs and circumstances, and it's based on the current experiences of 7 health centers. And then I've taken language, which I'm going to share with you, about these tools that are on the screen from their respective websites. I'm not endorsing these tools, just letting you know that they are out there and I've come across them in my research or at conferences or through word of mouth. So these are tools that are not free, that actually you would pay to be able to access. But uncovering the social determinants of health and addressing them is critical for improving the health of populations, because these factors affect current mental health as well as potential mental health later in life. Through an appropriate assessment process, behavioral health professionals must determine which social factors are driving widespread health disparities so that they know where to intervene. Thus, conducting a social determinants of health assessment is key to improving individual and population health. These are resources to help you design your strategy for data collection, analysis, and action, all of which will differ depending on your setting, scope, clientele, and human and financial capacity. Find Connect is an innovative solution that empowers patients, care teams, and community organizations to collaboratively address social determinants of health, such as food insecurity, housing instability, and developmental issues. This family-centered and customizable technology platform enables data sharing across care providers and settings, greatly improving the quality and consistency of care. So that's at findconnect.org. Healthify helps healthcare organizations find community services, track social needs, and coordinate referrals with community partners to radically improve the health of the people they serve. Using Healthify's tools, users can search, filter, edit, share, and refer community organizations, social services, and government benefits. That's at healthify.us. NowPow connects people to high-quality community resources to help address their chronic health and social conditions or just stay well. From stress management to smoking cessation, fitness classes to family planning, NowPow makes it easy to leverage knowledge into action. NowPow's data engine is a deep and complete community resource directory regularly updated by an in-house team. They have powerful filters and data-driven condition and assessment algorithms built into the technology to ensure that the recommended resources reduce barriers to care, and that's at nowpow.com. So once again, those are resources that I've checked out that all seem very promising, but I've spoken with people who have used them and they're getting good results, so they're worth taking a look at. We have about 10 minutes left, and I want to make sure that you have time to ask questions, but I wanted to take you just to some of these resources that I had mentioned to you. So this is County Health Rankings, and it's really incredible because there is so much information that is really at your fingertips here. So even if you were able to click on the rankings, and this is what I mentioned before, when we're really looking at what contributes to our health outcomes, that our health behaviors, our clinical care are about 50%, our social and economic factors and our physical environment are about another 50%. And so if you're interested in kind of digging down more into that, you can do that here. So if you wanted to kind of see more around housing and transit, you could do that here. And it would give you more information about what does that really mean. So if you go to severe housing cost burden, for example, and you wanted to explore the data, I'm just going to go here to look at California. And it will tell you severe housing cost burden, the percentage of households that spend 50% or more of their household income on housing, 50% or more. I mean, think about how dramatic that is, how little is left over for the other necessities of life. When you're spending 50% or more, it's recommended that you not spend more than 30%, and even that makes your budget pretty tight. And so here in California, this is by county, you can see the percentage of severe housing cost burden within the county. So 18% of the population, Alameda, which is where Oakland is. This is a rural county, Alpine. 25% is severe housing cost burdened, right? If you look down at Sacramento, where I am, it's 19%. Los Angeles is really high also at 25%. So it gives you the data that you may need if you're doing grant reports, if you're writing grant proposals, if you're going after partnerships, if you're wanting to make changes to policy, to advocate for changes to policy. It's a wonderful way to be able to get the data that you need. You can also go to Take Action to Improve Health, and you can get information about who to work with. So let's say that you wanted to look at community development. It tells you how community development is related to health, and then actually gives you some really, I think, important information about the kinds of policies that are out there, about definitions that are there, physical displacement and emotional displacement, and then who it is that you may be able to work with, right? And then even with learning from others, which is another great tab, you can see what other folks are doing. And so there are lots of communities that are really taking on the same kinds of issues. There's a map of the communities that have gotten the Robert Wood Johnson Foundation Culture of Health Prize winners, or Robert Wood Johnson Foundation Fellow myself. So I'm always interested in what it is that they're doing. You go to a place like Santa Cruz here in our region, and you can find out the kinds of things that they've been doing, which are addressing all of the issues that we've been talking about here today, about food insecurity, about getting young people involved. Okay. So that's one of the resources. The Prepare, Implementation, and Action Toolkit also. As I mentioned, it's modularized, and so you can actually just go through and see where is it that you need to know more, like building capacity to respond to social determinants data, responding to it, all of that, developing your strategy, assessing your setting. It's going to give you some pretty clear-cut information about how to move forward, developing cross-sector partnerships, which we've been also talking about today. And then these are the websites that I also mentioned. This is Find Connect, addressing the social environmental factors that impact health. And all of them give you the opportunity to schedule a demo. So it's not like you have to pay for anything without knowing what you're getting into. But if you want to just know more about what the service is, then they all offer that. You can schedule a demo with Healthify.us, which has solutions for social determinants as well, and NowPow, around powering networks. So I just wanted to show these to you once again, and there's a requested demo here for NowPow. Okay, so Alejandro, here in Arizona, under the NCOs, we are trying to track social determinants of health via zip codes. Yeah, absolutely. Okay, well, thank you, Alejandro. You are so very welcome. And we are really at the end of our time. Are there other questions or comments that people have? You're so welcome. Monisa, it's your last opportunity to ask a question before our webinar is done. You're an awfully quiet group. I hope we met your needs. And that's right. So this is the contact information. If you have not gotten on board with getting the newsletter, please do. It's really timely and interesting. And once again, you can let us know about your training and technical assistance needs and topic interest. And we thank you for attending. You are going to get a link to, I guess it's not a link, you're actually going to get the survey itself come up. And so we hope that you will fill that out so that we can continue to offer these services to you without charge. And our last slide from SAMHSA, which also has really wonderful resources on their website. If you have not been there, by all means, go and check out what SAMHSA has as well. All right, thank you all. I see your messages. I appreciate it. Have a wonderful rest of your day.